Hey everyone, I'm Megan with the I Believe podcast, and today we have an amazing guest. We have Mark Moore. Now, I'll tell you what's special about our guest today. Mark is not only a patient with ocular melanoma, he is also a physician's assistant. So I think this is probably the first guest we've ever had that's bringing both sides, the physician side, the medical knowledge, and the patient. So this is going to be a really exciting episode for us. So Mark, welcome. And you are 5 months past treatment. So tell us a little bit about yourself.
I just turned 55 when I got diagnosed, kind of like the median age for diagnosis, I think. I am a physician assistant. I'm originally from Kentucky, so I grew up on a small tobacco farm. I've lived in multiple different areas. I've lived in Atlanta. I lived in Phoenix, Arizona for 18 years. And that's when I became very sun aware of, wearing a big hat, wearing sunscreen, wearing my sunglasses. I have light-colored eyes, so being out in bright light has always been uncomfortable for me. So I've always taken really good care of my eyes. I moved to Tennessee about 2.5 years ago to be closer to family, and that's when my journey with ocular melanoma started. What I wanted to tell about my story is being a physician assistant. I've worked in infectious diseases, HIV care, so I've been involved in this field since the mid-90s when the AIDS epidemic was really bad. So I've definitely had a lot of carryover from that with patients who have been very sick, patients who have died, and I've had those end-of-life discussions with them. And that's not where I want to go with my talk today, but it's always something that I think anyone who lives with ocular melanoma, because of the seriousness of it, has in the back of their head. I love being outdoors. I'm a hobbyist beekeeper. I'm a gardener. I love being outside. In September of last year, I was working in my garden, kind of bent over, doing some weeding, stood up, and I had this white flash. First time I actually realized it, not just like a spot, like my whole visual field turned white for just a second. And I had never experienced anything like that. I've had patients have retinal detachments, and they have come in and said, I have like this curtain that's come down over my eye, and it's just black. I can't see. It's not what I experienced at all. It was instantaneous. It went away. I went about my day. It didn't happen again for a few weeks. Then I was outside again, and it happened. And I thought, well, maybe it's because I'm not wearing my sunglasses, that the sunlight's coming at the wrong angle. You want to convince yourself that nothing's wrong, right? So you try to reason past it. I've been a glaucoma suspect for years, which means I have high pressure in my left eye. So fortunately, I'd already had an ophthalmologist that I see annually to have checkups on that. I was a little bit overdue at the time. So I was supposed to have gone in June, and this was already September. My work asked me to travel back to Phoenix, where I'm from, or where I'd lived actually for 18 years. To help with clinic coverage there. So I did. Phoenix, as you know, is very bright. I got there tired, didn't sleep well, went to work that day, and I had another flash as I was going into work, but I was outside again. So I thought, well, that's weird why it's happening now, but it kept going. I was there for a week. It happened a couple more times while I was there. And then the very last night I was there, I was in the hotel room. All the lights were out. I was in bed. My eyes were closed. I had another white flash. And so that's when I knew something was really wrong. And I could no longer just chalk it up to, this will go away. This is something really wrong. And it was my eye that it doesn't have the high pressure. It's what I call my good eye, because my vision has always been crystal clear in this eye. So fortunately, where I was already in care with an ophthalmologist, I was able to call them. They got me in a week or two. I always take off a couple weeks in October because that's my birthday month. And I love October. It starts to cool down in Phoenix, and here in Tennessee, the leaves start turning. It's very pretty here. It's very beautiful. So I went in on my birthday, and so got my checkup and told my ophthalmologist, hey, the other eye, I've been having this white flash in it. I don't have it all the time. My vision seems fine otherwise. And so they looked at my eye, and he leaned back and he said, do you know what a choroid melanoma is? And I was a little confused, a little stunned. I said, well, yeah, I've heard of it. It got honorable mention in PA school. I've honestly never had a patient with it. It's very uncommon, and I know it can be serious. And he said, well, I need you to understand, I don't know that's what this is, but it's very suspicious because that was what I'm looking at was not there last year. So he said, I want you to go see a specialist. And I thought, okay, well, this is going to take 4 or 6 weeks to get in to see another specialist. So I'm going to have to worry about this the whole time. And he said, no, we're going to call and get you an appointment as soon as possible. So I actually got in the next week, went to see my ocular oncologist, and he confirmed the diagnosis. That's when things got a little overwhelming, I would say, even for me. I mean, I have a lot of health literacy. I know what the terms mean, but being able to process all this information that's being given to me quickly to make informed decisions for myself was honestly quite overwhelming even for me, because we're talking about a cancer that's vision threatening and it's also life threatening, right? So I have been fortunate. I've been relatively healthy up until this point, until I found out on my birthday that I have ocular melanoma. So the ocular oncologist told me we need to treat this as soon as possible. So we talked about brachytherapy or radioactive plaque. And I'm familiar with it, but I, again, never had a patient who's had this before. So I didn't really understand what would need to happen as far as like a surgery. So of course I had lots of questions, wanted to learn more. In my field, we have some luxury that, when we tell patients that they're living with HIV or that they have another infection, we have a lot of education materials that we can give out. Very nice. It's on 6th, 7th, 8th grade level for people to understand. I got nothing. So of course, I had to start doing my own research. I'm fortunate that I have access to some medical databases that I can look up things for myself. But, you start looking at Google as well. And, Google will tell you, half the patients who get ocular melanoma get metastatic disease where the cancer travels to other areas. So it really is very difficult to process all this information. I'm very fortunate that I have very close family. I called one of my sisters and told her. My other sister, I drove up to tell her in person. And my family is Appalachian, so when they hear the cancer word, it's has a big impact, especially for our culture. And being able to have them in my corner has been very helpful. I didn't know anyone else who's gone through this. I didn't have a lot of information that I needed to filter through. And that's why I wanted to tell my story today, so maybe it could help other people learn a little bit more about this. When I went to see the ocular oncologist, they told me my tumor, it's 14 by 12 by 5.8, which is medium size, pretty good sized tumor. I don't know what that means. They tell me I have a T2 M0 N0. I don't know what that means. So I have to teach myself how to do this. And having the medical background, fortunately, I can get up to speed quickly, but others may not. And then trying to understand what happens with the surgery, how much vision will I lose? What's in the future for me? These are also things I have to try to educate myself and my family about.
Castle Biosciences is a proud sponsor of this I Believe podcast. Castle's innovative uveal melanoma tests provide valuable information about the risk of your eye cancer spreading to help you and your healthcare team individualize the management of your disease. To learn more, visit castlebiosciences.com.
So, Mark, how has this diagnosis either affected your career, or how does your career and your knowledge play into coping with the diagnosis?
It really strips you down to just being a patient, right? We're all consumers of healthcare at some point, and unfortunately, this is my time to be a consumer of healthcare. It really has affected me. I've always tried to be very empathetic when I talk to my patients. I've had very complicated history doing HIV care, coming from the AIDS crisis when almost half of our patients were eventually in hospice, having difficult conversations with them, being very empathetic. But this has really changed me as far as my empathy level with people, understanding more about trauma, where people come from, This is a traumatic event for me. When I talk to people that know what's going on with me, especially friends or family or just acquaintances, the question I get is, how's your eye? That's not the concern, because with the brachytherapy, it's like 95% successful at local tumor control. But the bigger thing is, always on the look for a metastatic event with this. So now knowing what that triggers me a little bit whenever people ask me the question, because I really still don't even know how to answer without, trying to make them feel, well, I don't try to make them feel anyway, but trying to explain to them without them feeling guilty of asking the question, because I appreciate the empathy. It's helped me when I talk to patients and maybe they're upset, or maybe they're angry, or maybe they've missed a couple of appointments. Where's that coming from now? Do you feel like you are just giving up? Do you feel like you don't have support in your corner? Do you feel like, it's just too much to navigate? Because even for me, it's a lot to navigate. So it really has made me more sensitive to what my patients are going through.
And do you feel like, because you're in that industry, that having some of that knowledge was maybe a little detrimental, that you maybe like knew too much?
Yeah, it is. There's a fine line between knowing too much and not knowing enough, right, to make these decisions, because I think a knee-jerk reaction is, well, just take the eye out. I don't want to, have to even worry about the tumor there. But then you go and start reading about it, and it's like there's no benefit to this, to taking the eye out if you can treat the tumor itself. One thing that's, been a little difficult with the journey is the term useful vision. I keep hearing that, even early on, we want you to have some useful vision. Well, how much useful vision will I have? And I can't get an answer to that, So the term radiation retinitis comes up. Fortunately, I understand what that means, but how much damage and how much vision will I lose over time? No one knows. They can't predict that until the event happens. I have had some dimming of my vision, which is a little distracting. This whole area here is blind. I can't see my hand moving. My central vision is great. Fortunately, my other eye has very good vision as well. So it's been an adjustment, and the feeling that the dark area, the blindness kind of creeps in. Like, is it getting any bigger? That constant worry there is always there too.
Definitely. I mean, it's a huge adjustment to understand that you are a cancer patient, to go through the treatments, and that's your new everyday, and then also have the vision impairment on top of it, because you have to relearn how to do everything. How was that for you?
Yeah, a little difficult, actually. So when I moved to Tennessee, I took a telehealth job. So I do a lot of telehealth, so working on the computer, right? Which, already being in my mid-50s, is a challenge with my eyesight as the day goes on, because your eyes get tired, and using a computer, trying to focus with it. After the surgery, I was told you need about 2 weeks and then you'll be okay to go back to work. Well, I still couldn't use the computer. It was so difficult. Fortunately, my work has been really good. They've been very accommodating for this. So yeah, the visual change has been a challenge for me, just based on my work, the type of work that I do working with telehealth. I do get to go into the clinics. Fortunately, my central vision is very good. I can still see, I can read without glasses, not a problem. So being able to do a physical exam, because a lot of times people come in, they say, what's this? They'll show you their skin. What do you think this is? Well, I need to be able to see clearly to be able to help people with that. So change or loss of vision is very concerning for me, and the trauma of having this. And when I first got the diagnosis, I was actually practicing walking around, not using the eye at all, because I didn't know how much vision I would lose. And I think people tried to make me feel better and say, well, you have another eye. So, but if I told someone you're going to have to lose your leg, I'm not going to try to make them feel better by saying you have another leg. I think, people really try to support you and help you and try to make things look a little better, but they don't also realize how traumatizing it really is, because my vision, for me, that's the main way I learn. I'm a visual learner. I needed to do my job. I needed to do a good job for people. I needed to get around. I needed to drive. So it's kind of scary whenever you learn that you have something that may actually cause you to lose your vision.
Absolutely. And I mean, we've talked about it on this podcast several times about how the well-wishers, sometimes the things they say that they think are helping are actually very hurtful, and they
Yeah,
just don't know any better because they've never been through it.
exactly. And,
Yeah.
and you realize for sure when you talk to people, they have that concern. They don't know the questions to ask, right? They don't know how to make you feel better. I think if I could say something to people, um, for someone who's struggling with this, not necessarily ask, how's the eye? Ask, how are you doing? How are you doing with all this? Because it really has been a struggle. It's been from feeling overwhelmed to feeling depressed to going through a lot of pain. The surgery was very painful for me. I had a bad corneal abrasion during the surgery itself. So that's not fun. And then I was able to come home after surgery, but then had to stay in my room basically for 5 days because of the radiation. I did have a lead patch so I could come out and get dressing changes, but I've got two small dogs that I don't know what that level of radiation does to them, because they want to be like right in my lap the whole time. So it was quite an adventure to get there, and I know that people wish us well. I know that people want us to be better, but um, just ask people, how are you doing? Overall, I think is the best thing you can ask. The other thing that I've been really grateful for your podcast and other ones that I've found is the information that's getting out there. You know, my niece's husband, he got diagnosed with cutaneous melanoma recently, and so he had surgery, but he also got adjuvant therapy. And I heard the podcast recently about some of the neoadjuvants that they're looking into, which is great. But why don't we have that now? If that was available now, maybe there'd be a lot less worry about metastatic manifestations later.
Definitely. And I think that's why this is so important for our exact niche cancer is it's such a small community that if we're not loud, we're not going to get any attention, funding, research. Like we have to make the noise. And so that is the whole point of this.
Yeah. I mean, 5 to 6 people in a million that get this, 2,000 of these a year. These orphan cancers or orphan illnesses, industry unfortunately just doesn't put the money into the research. It is a business in the United States, right? And unfortunately, unless they see the profits, they don't really fund it a whole lot. Now that we're under threat of having even more research funds cut from us, I don't know where the future lies with this.
Right. It's a definite concern. So, what kind of things did you do to help you cope when you were finding yourself dealing with anxiety and depression and all of those emotions that are so normal that everyone's going to go through when they get this diagnosis? What did you find was helpful to get you through those things?
My family, number one, people that are in my life, my husband, very supportive. There are things I enjoy doing, like I'm a hobbyist beekeeper, and when I got the diagnosis and did feel kind of down, I thought, well, what am I going to do with these bees? Am I going to be able to go through the hive and see, do I need to stop this hobby? But I realized that, you have to live every day like you're going to wake up tomorrow and it's going to be fine. You just have to do that with this. So I kind of delved into it now, and I got like 4 more colonies on top of it. So now I'm really busy, keep myself busy with the things that I enjoy, right? So that also was part of my decision on not having the biopsy during surgery. I know that's a very difficult decision for a lot of people too. I don't know if people get enough information about making an informed choice about the biopsy or not. But for me, I just didn't want to know my genetic markers at the time. It was so devastating learning about this. If I had a bad outcome on the biopsy, I think it would affect the way I approach every day. So for me, I just decided not to. Um, so I think that's something else that people need to get more information on because it was just left up to me. Do you want this biopsy or not?
Aura Biosciences is a clinical stage biotechnology company focused on developing precision therapies for solid tumors that aim to preserve organ function. Our lead candidate, Belsar, is currently in late-stage development for primary choroidal melanoma and in early-stage development in other ocular oncology indications and bladder cancer. Our mission is to grow as an innovative global oncology company that positively transforms the lives of patients. For more information, please visit us at aurabiosciences.com.
Yeah, I completely agree. I think that is such a hard choice to make. And if you don't have all the pieces to make that decision, I mean, how do you go about it? And it is such a personal decision because everyone feels so differently. Some people want every crumb of information, and other people are like, no, it's too much.
Yeah, it's too much. And uh, again, I just didn't feel prepared for getting the information. And I was a little worried because this growth was not there in my eye a year ago, right? And then all of a sudden it shows and it's pretty medium size. So is this an aggressive, genetically influenced cancer? But what's the difference in treatment right now, right? There's not a whole lot of difference. You still go through the radiation, you still go through the monitoring. Maybe you get the monitoring a little more often. But for right now, I'm on an every 6-month plan. So every 6 months, I go in and get CAT scans of my chest, abdomen, and pelvis. And I guess I'll be doing that for several years.
So now that you're 5 months out, how are you doing right now and how are you feeling?
Doing well. I'm still coping with, like going into a dimly lit room and there's this black entity that's like right here to my side. Or someone all of a sudden pops up in front of me. I'm like, oh, where'd you come from? I've learned when I'm driving to turn my head a little bit more so that I can see what's off to my right. So you do have some adaptive strategies that you do. I'm very worried now about accidents to my eye. So I'm constantly, like, I really try to take care of my eyes if I'm doing any kind of project, wearing glasses or sunglasses so that nothing gets in it. I'm a little self-conscious about it. But I think overall I'm doing well. Now that I see that I look more like I did before surgery because there's been a little drooping or ptosis that I see in pictures. It's getting better. That has helped my attitude a whole lot. When I first had the surgery for a week or two, I had my sunglasses on when I would go out. And I would take it on. My eye was so red and swollen, people would kind of step back. Now they don't do that. So I think life's kind of gotten back to normal. I try not to get too worried about what's going on, but I try to stay informed. So that's how I got involved with your podcast, listening to it, and it's been very helpful for me.
Well, I'm thrilled to hear that it's been helpful. I'm, of course, incredibly sorry that you're in this situation from the very beginning, but I'm glad that we could be here to help, and I'm glad that you're here to share your story because it is so important. And I think when you're in such a small community of patients, hearing everyone's story, it really does help you realize that you aren't alone and you aren't the only one because it does feel like that. Like, why am I the only one that has this?
It does. And, as I slowly inform people around me, I'm starting to hear, oh, my uncle had that back in the 1990s. And someone that I work with has someone very close to them by marriage and their family who has it. So they kind of understand a little bit more about it. But for the most part, when you tell people, they're like, I've never heard of this, or did you get too much sun exposure? The one thing that's been the most helpful is my ocular oncologist. When I first got the diagnosis, he told me that that's for sure what this is based on the exam. He said to me, this is not anything that you did. We still don't even know what causes this. And that was actually quite helpful because, you worry, like, did I have some kind of chemical exposure? Growing up on a farm and living in Arizona, I did get a lot of sunlight. But knowing that it's not anything that I did takes a little bit of the onus off of me too.
I think that's huge. I think in every part of life, having somebody else validate that you're not at fault is so empowering. And I mean, it really is such a small sentence that carries so much weight. And I grew up in Phoenix, actually. I don't know if you knew that, but
Okay, I didn't.
I did. I lived there until I was 20. And I mean, we never wore sunglasses when I was a kid and a teenager. And I have had that thought of, I mean, I obviously have very light eyes, and I have had that thought several times because my mom has ocular melanoma, and am I going to get it? Because, yeah, they say it's not really genetic. They say it's, they don't know about the sun exposure, but that's kind of two big deals. So it is something
Yeah.
that you do wonder, like, should I have done it differently? What if I did wear my sunglasses? What if I didn't do this? What if you could go on
Yeah.
forever.
Right. And, trying to educate myself a little more now that I'm able to do that without the emotional part, of how it affects you. I'm starting to learn of an association between Parkinson's disease and melanoma. I think we talked about this before. My mom actually got Parkinson's disease while she was pregnant with me. She started having symptoms of it, was diagnosed before I was even a year old. So I've learned that there is an association with melanoma and Parkinson's. The persons with Parkinson's have a 4 times higher risk of getting melanoma and vice versa. And that may even include uveal melanoma. So there's a little bit of information that siblings of people with Parkinson's disease may have increased risk of melanoma, but there's no information that children of people with Parkinson's have it. So is there a genetic influence here? Those are things you start wondering about, well, like, how did this happen? So the research needs to get a little better, I think. But as you pointed out, the funding's just not there. And it's hard to get the information out to people who need it quickly, because I had a luxury, like I said, of being pretty health literate and having time from the time I saw my ocular oncologist till I had the surgery was about 5 weeks. So I had 5 weeks to learn about this. A lot of people, who have large tumors, they may have to go have surgery in a day or two. So how do they deal with this? I think if there was one spot where people could go, and your foundation and some of the others that put information out there to kind of put it on a level where people can understand quickly, is great. Finding other people in our community that we can talk to and ask questions. How did you deal with this? The Facebook groups and being able to reach out to folks who understand has been real helpful too.
I think that's a huge part of it, is, like we said before, knowing that you're not the only one, even though it feels like you are. So I do encourage anyone to join a Facebook group. If you go to acureinsight.org, our website, there's a button to go to the Tuesday night Zoom meeting link. And every Tuesday night they do a Zoom meeting, and they break out into 2 different rooms, regular and metastatic. So if you don't want to, if metastatic's not for you, you don't have to go into that room. But I think if you can connect with other people and just hear someone else's story, or share your story with someone who's going to say, yeah, I get it. I mean, I think that's so huge. And I do encourage anyone to just try if you haven't yet. Yeah, it's really important. So I hope that everyone can find something that makes it a little bit better for them, whether it is a Zoom group or a chat room or, beekeeping. Find something that helps you along your path.
Gardening.
Yeah, something like whatever's going to bring you the joy that you need to get through that day. And maybe look at it as, one day at a time. Like you said, you can't look at the whole picture right now. Just look at a little bit of the picture, and that's enough.
Well, and I'd also like to encourage people that are going through this, don't just accept what your healthcare providers are telling you. Ask questions, ask the detailed questions, and maybe you don't have enough information to even ask the question, but who can I call when I have questions after I leave? Where can I go for this? Because that information is important for you to make informed choices. It's really important that you understand implications of your choices, because, like, for instance, the radioactive plaque, which resolves the tumor, what's the long-term outcome with that? Will I get cataracts? Will my lashes fall out? What does it affect me on the other side, because it is radiation? So those things need to be carefully explained, and you should have your questions answered. So as a patient, I really strongly encourage you to speak up, find information that's on your level that you can understand clearly, so you can make these informed choices.
Yeah, I mean, knowledge is power, right? And if you want your power, seek it. Go ask the questions, do the research. And if you get overwhelmed, find somebody in one of the chat groups who has a similar situation and ask them, what did you do? What did you find? What did you ask? What did they tell you? And that's a great place to start too.
Yeah, absolutely.
Absolutely. All right, Mark, is there anything else you'd like to add before we wrap up?
No, I just wanted to thank you guys for all that you do for our community, and just want to encourage anyone who's starting their journey with this, don't give up hope. Things get better over time. There's good treatments that are coming. As long as you've got a good team on your side, as long as they're communicating with you, you've got a good place to go.
Definitely. And in the vein of asking questions, also, it's okay to get second opinions. We encourage you to get second opinions. Find a doctor or a team of doctors that you love or that you trust, I guess is more important. And if your current doctor or, one of the people in your team isn't quite a good fit, go get a second opinion and find somebody that is more of a good fit for you.
Absolutely. And, my particular situation, I was very fortunate to have a team that I like quite a bit. My ocular oncologist is great. I feel like we communicate well. He even gave me his phone number to text him during my 5 days at home. I want you to text me every day how you're doing. If you have any questions, any concerns, and he gets right back with me. So it's been good to know that I have someone who's concerned about me as a patient too. And I was very fortunate for that because I live in a fairly rural area. Resources are a little limited in the greater Chattanooga area. So if I wanted to go find another specialist, it would be a 3 or 4 hour drive. So I'm very fortunate with where I am.
That's fantastic. I'm happy to hear that.
Yeah.
All right. Well, Mark, thank you so much for being here and thank you for sharing your story. This is really important and I'm just thrilled that you came and trusted us to help you put that story out there. And to everyone who's watching, please join anything that we put out that you think is helpful to you, whether it's our Zoom on Tuesday night. You can find it on our website. We have multiple Facebook groups for different things. If you need help, reach out to any of us. All of our email addresses are our names at acureinsight.org. So you have Megan, Danae, Melody, Lauren, Suzanne. It's all at acureinsight.org. Marlene, any of us, we're all happy to help you. And then also on our website, you can subscribe to our newsletter that comes out once a month at the end of the month. And it has a lot of great information, upcoming clinical trial information, different things like that. And we are just always trying to put out good content to bring to you. So please subscribe on our YouTube channel as well as anywhere you get a podcast, Apple, Spotify, Podbean, etc. And follow our social media. We are trying to bring a lot of information, a lot of awareness, share patient stories. If you'd like to get involved, contact us. We have a lot of ways you can get involved with us. And we're just happy to be a part of this community and be as helpful as we can and bring this stuff to you, connect you, whatever we can possibly do. So if there's anything that you see needs to be done in the community that we're already not doing, also please reach out to us and let us know what you want to see and how we can make it happen. And we'd be happy to help you there. So until next time, everyone, I hope you all stay safe and well, and we will see you next time.